Are you looking to make a real difference in the lives of those suffering from long COVID symptoms? Well, I've got a study-based acupuncture solution that can provide relief and improve the lives of those suffering from long COVID. I've been asked for weeks now and probably months, Clara, what do I do with my patients when they come in and they have long COVID symptoms, residues? Well, today is your lucky day because we're finally going to dive into it. Today I'm going to discuss the long COVID symptoms, what are they, and how we can help our patients using 12 acupuncture points, top 5 plus 7 that we can combine with the top 5 in order to get relief for those common long COVID symptoms. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy and I create Chinese medicine and acupuncture contents for students and practitioners, making it easy to grasp and fun to learn. Let's do this. But one of the things we have to do before we start discussing how to treat is figure out what exactly happened in the TCM perspective when someone was affected by the virus. So in general, a reminder is we have the Wei Qi, the defensive Qi or immune system in Chinese medicine, and we have pathogens. And those two are going to battle out. So the pathogens have to have a strength and the immune system has to have strength. Which one is stronger will win the battle. When people contracted COVID, if their immune system was very strong, very powerful, they experienced some symptoms, some people not many symptoms, and recovered quickly. Other people, obviously, their immune system was not very strong and the symptoms lasted a long time, were very powerful, and obviously, as we know, for some people, it led to losing their lives. Now, what happened later on? For those people that experienced long COVID, well, the pathogen penetrated through the body and went through different layers and different levels. So in Chinese medicine, we have the 6 stages and the 4 levels. I think with COVID, because it was so much heat, it was wind and heat that penetrated in the body because it was mostly a lot of fever with this virus. So it was more going through levels. And the 4 levels in Chinese medicine start with the Wei Qi, the defensive Qi. Then they can go to the next level, which is the Qi level and the bleed Qi. This is why people that have long COVID will probably end up with lung Qi deficiency, spleen, kidney, and heart Qi deficiency as well, depending on their age, their lifestyle, the amount of stress, and all the other factors that can affect patients. Now, what happened is after the Qi level, the next level is going to be the Yin level, Y-I-N-G, which is the nutritive level. And the next one after that is the blood level. Now, when it gets deeper and deeper and deeper, we get more symptoms and it becomes harder to expel, to push the pathogen out of the body, right? And so for patients, when that's going to happen, we're going to have not only Qi deficiency, but for some people, Yin deficiency, because at the nutritive level, the heat is going to start drying the fluid, and our yin, the body cooling system, cannot fight it for too long, and eventually we become yin deficient, which means our cooling system is not able to perform anymore. So that's going to happen for a lot of patients. And 2 other patterns that may show up is blood stasis and phlegm as well for a lot of patients. Now, those are the most common pattern we're going to see, but no matter what, we always have to make a TCM diagnosis for each of the patients that come through our doors. And the points I'm going to discuss today are really good to help our patients. However, always adapt and make sure the protocol is specific and unique to that patient. So what are those symptoms that long COVID patients experience? They range from fatigue, insomnia, chest pain, joint pain, palpitation, anxiety, depression, fatigue, brain fog, loss of memory, and the one that we obviously have heard so many times is the loss of sense of smell or sense of taste. Those are the common ones we see in clinical practice, but they're not exclusive. Women have experienced a lot of reproductive system issue as well. Now let's talk about the best acupuncture points based on a study, which I'll link below for you to check out and share with your patients, and are really useful to make a difference in the lives of our patients. By the way, if you haven't checked out evidence-based-acupuncture.org. This is powered by Acupuncturist, and it's a fabulous website where you and I can share all those studies with patients and show the world that yes, indeed, acupuncture is evidence-based. So we're going to start with the top 5 acupuncture points, and then we're going to add up 7 more to combine with those top 5 in order to get the relief that we need for our patients and the long COVID symptoms. Number 1, you knew it, obviously, stomach 36. Located 3 tsuen below stomach 35 on the lateral side of the knee, and it is 1 finger breadth from the shin or the tibia crest. Now, stomach 36 is probably one of the most common acupuncture point used in clinical practice because it is the commander point of the immune system and the digestive system. So of course we have to use stomach 36 to boost the immune system. However, stomach 36 is also the only point that tonify qi and blood together. So this is very useful for qi and blood deficiency patients. This is why when there is a lot of fatigue, we have to use stomach 36 because it'll boost the qi. Now, combined with stomach 36, we're gonna have to add up do 20 to lift the energy, ren 6 to lift more energy, and spleen 6. This is a great combo, stomach 36, spleen 6, ren 6, and do 20, lots of 6s. Best combo when there is fatigue. Number 2. Long 7. We knew that was going to come. Long 7 is located behind or superior to the styloid process of the radius on the wrist area, 1.5 tsuen above large intestine 5. Long 7 is a perfect point to combine with stomach 36 to boost the immune system, but it also helps with chest pain, coughing, and shortness of breath. So it's the perfect point to combine with ren 17. Ren 17 is in the chest and opens the chest to relax the chest for palpitation, for chest pain, for coughing. Number 3, spleen 6. Spleen 6, because it is the crossing point of the liver, kidney, and spleen, is really good for digestive system issue, reproductive system issue, and mental health. So using spleen 6 specifically for the anxiety, the insomnia, and for regulating hormones, because many women who contracted COVID-19 have had residues of issues with their menstruation cycle. So this is a really good point to combine spleen 6 specifically with spleen 4, pericardium 6, long 7, and kidney 6. Really great to rebalance hormone. That's a perfect combo, those 5 points, spleen 6, long 7 and kidney 6, spleen 4 and PC6 or pericardium 6. Are you enjoying my graphics so far? Well, you can find them all in my AcuPoint Made Easy, an illustrated guide to all acupuncture points, and so much more. The PDF version has a lot of video links. You can download it on your phone, your tablet, your computer, and have it at your fingertips at any time. It has a great table of contents. The hard copy ships all over the world if you're someone that loves to hold a book and really enjoy the colorful part of my graphics. You'll find them all exactly the same as the PDF in the hard copy book. The feedback has been amazing. As you can see here, so many people have just loved the book or the PDF or both. So what are you waiting for? Click the link below and get your copy today. Number 4, large intestine 4, the commander point of the face and the best point to relieve pain. So for joint pain, for chest pain, for headaches, this is the point we have to really utilize for our patients who are suffering from long COVID, because headache, I've seen it. It is a really long-lasting issue for patients with long COVID symptoms. So LI4 is great also to be combined with long 7 and stomach 36 to make sure that we keep the pathogens, external pathogen, out of the body so we don't get sick again. So it really helps with the immune system as well. Number 5, heart 7. Because a lot of long COVID patients have insomnia, anxiety, palpitation, and this is the best point to add to your protocol in order to calm the mind. Also, it's really good for poor memory, which a lot of patients with long COVID symptoms are experiencing as well. Now let's combine those 5 top points with 7 more in order to get a little bit more specific. When it comes to fatigue, according to 3 studies, Stomach 36, spleen 6, and large intestine 10 are the best combo. Personally, I would add do 20 and Ren 6 to that. When it comes to coagulation issues like blood clots, large intestine 4 and liver 3, the 4 gates, open the flow, so we have to do those, plus spleen 10. This is the best combo according to another study. When it comes to brain fog, stomach 40 is probably the best point. We want to combine it with stomach 36, spleen 6, because usually there's a lot of fatigue, but as well do 20 to be able to lift that energy and clear the mind. I would add up yin tong because there's a lot of stress for the patients that are experiencing long COVID because they feel like it's never going to go away. That's a great combo for brain fog. Now for headaches, large intestine 4, liver 3, gallbladder 34, but I would also look at where the headache is located and allow myself to pick distal points that are going to affect the area. Temporal headache, we want to use gallbladder 40, but if it was frontal headache, stomach 44, if it's occipital, bladder 60, right? We want to see where the headaches are and we want to combine the right point. According to another study, when patients experience elevated liver enzymes, here are the best points that were really useful in lowering those liver enzymes. Large intestine 4, liver 3, gallbladder 34, and Ren 12. Best combo according to a study to decrease the elevated liver enzymes. And when it comes to inflammation, the best combo, again according to a study, is large intestine 4, large intestine 11, because large intestine 11 clears heat, so great for inflammation, and stomach 36. That is the best combo. So as you can see, there's a lot we can do for patients suffering from long COVID. The top 5 we have to do is stomach 36, lung 7, spleen 6, large intestine 4, and heart 7. And then we can add up other points, combining with those in order to get a great outcome for patients. No matter what, it's really important to make a TCM diagnosis and to collaborate with other practitioners in order to help patients. I truly hope this information makes a true difference in the lives of your patients. And no matter what, keep rocking it using TCM.